Welcome back to series of healthy health and preventing COVID-19 infection during current epidemic number 50. In this video, we are going to discuss about the realistic steps needed to fully control the COVID-19 epidemic. In this regards, very few countries have restored to aggressive measures, including so-called cordon sanitaire, which is basically graded guarded areas in which an individual may not enter or leave, as happened in several cities and states. Large-scale ordering of individuals to remain in their homes at all times, or in worst-case scenario, imposing worthless all 24-hour curfew for weeks at stretch. Now, COVID-19 is not an enemy. He doesn't understand the curfew, but people do. So the goal should be to prevent the people getting harmed and through that to control the COVID-19 through medical and laboratory investigations and taking meaningful and humane steps. So, imposing non-strategic multi-week curfews or multi-month curfew is a last resort intended to control riots and war situation and is not intended to control epidemics. Most certainly not epidemics like COVID-19. Such is in fact not only less effective than targeted and strategic control in combination with the disease prevention methods for preventing the spread of COVID-19. For example, when the curfew is lifted, people flock in thousands to purchase their essential supplies, medicine, and obtain money from banks, etc., as we have witnesses in some countries. Everyone rushes to the markets, including those carrying the virus, not knowingly, because there are many thousands of asymptomatic carriers in the community, thereby infecting others not knowingly. An effective and easy way to avoid this was described in my video series 48 and suggest that administrators to visit that to find such a simple way to an effective way to prevent crowd gathering at supermarkets and grocery stores. So let us go through some of the fundamental steps needed to minimize the risk of spreading COVID-19. Number one, at present the most important is to markedly expanding the PCR testing to diagnose people who are already infected. One thing to keep in mind is that not all reverse transcriptase PCR kits are alike. Some kits that were rushed to the market, perhaps cheap, are poor quality and less sensitive, especially those coming from countries in the Far East. Sometimes as a donation, sometimes as a very low cost compared to reputed companies generating reliable, specific and sensitive PCR kits. The last thing is to import the poor quality testing kits which can give off false negatives and false positive, causing significant psychological and physical harm to people in the other importing countries. So because of these failed procedures and giving wrong information not only to the health authorities but also to the public. Now there are also variations of PCR methods. There are rapid tests where the results can be available under 1 hour usually, and in fact there are tests becoming available. The test results can be obtained less than 10 to 15 minutes. So such tests are very valuable and can be used on site, like in the airports, as a screening and diagnostic tool where we can get obtain the results when the person is already there. All other tests unfortunately needed the laboratory facilities and take longer time, hours and sometimes a couple of days to generate data. Fundamentally, the authorities must realize that when before they import or accepting even the free kits, these tests must be sensitive and specific, not a set of garbage tests they are dumping on some other country, so that it can be used confidently for making the diagnosis or excluding having the disease without missing or creating false information, so as the diagnosing of those who are positive confidently. The goal of these diagnosis tools is to identify positively patients at the earliest time point. So, testing all those who are exposed and are in quarantine centers is another story, which should be done on the day 13 or preferably day 14 before they leave the quarantine center. And indeed, what is not being done, which is very unwise, is that these people should be tested between the day 18 preferably, or at least before day 20th from the day they entered the quarantine center. Unfortunately, this has not been done in any country, even though it's the simplest and most important as well as common sense approach to be done. Whereas some countries adopted this the failed technology using the testing twice on the same day or on two consecutive days, which is absolutely worthless and is a waste of resources. And in fact, it is inappropriate because a number of people you can picking up by that test is less than 5%. Whereas if you do the test in the day 18, virtually all remaining the COVID positive patient who discharged from the quarantine center can be picked up in a highly specific and sensitive manner. The next one is to have the quarantine facilities, the separation of people with the humane isolation. Many countries actually do not even put the people in the quarantine centers because the centers is in the older people with the people with the disease are death sentence. People going in with the very healthy people and coming out with the infection make no sense, and to me it's a highly unethical process. We have proposed the ways to minimize or actually prevent the people getting infected from COVID, and unfortunately some countries the authorities have been resistant or actually preventing implementing this very sensible economical way of preventing people getting infected in the quarantine center for the reason which had not been divulged, perhaps political, but we don't understand. Next one is expanding PCR testing outside the hospital. This is insane that people are not doing, health department are not doing this. Such a simple and valuable testing tools available, including the community testing to identify and predict the pattern of silent spread by those who carry the disease. It's again, I have to say that it's insane that these countries' health authorities and administrators claiming that they have only few number of the people with the disease and very few deaths, but they don't do the testing in the community. How on earth they know that the number of people affected with COVID? They do not test it. All the data accumulated over the past 3 to 4 weeks from countries like U.S. and many others who have done the community testing with antibody testing in particular and the RT-PCR for active identification of the people with active disease clearly suggests that every person who diagnosed with the PCR in the hospital or quarantine centers or that kind of facilities, there'll be at least 10 or between 10 and 40 people in the community who are infected and silent carriers. They themselves do not know that they carry the virus and spreading to the other people. These are not being detected by the restricting PCR test in the hospital or some centers, which is, to be frank, is a ridiculous medical or health department decision to do such insane things. So, not only the community testing should be done in large numbers, in fact, much larger than that done in hospital, but this should be done statistically in randomly selected, otherwise healthy people, so that the data obtaining from the antibody and PCR testing can be extrapolated to the entire state or a country. So let me clarify that there are two types of tests available to date for PCR for COVID-19. So tests commonly done, and most of you are aware, is the testing for the presence of antigen or the some kind of protein in the virus using the so-called RT-PCR method, polymerase chain reaction method, which identifies those who are positive, including those who are asymptomatic but carry the virus. The next test is equally important, but some countries don't do at all, is antibody testing in the communities to identify those who had the disease in the recent past and now recovered. These two tests gives a completely different sets of but mutually very important set of data to make decisions on how to manage COVID-19 properly. So community-based tracking must be continued to identify the contacts, as done in almost all the countries. However, this should be done in a compassionate way and not like a riots rushing through the street and invading people's home. This is happening actually in countries which I do not want to name them. So these were done as a punitive manner for harming people, scaring people and threatening them, and then almost like putting handcuffs and marching them towards a quarantine center. This is again an insane thing done in countries because simply the authorities don't understand the people's needs, their psychology, and lack of compassionate attitude. In addition, the testing must have an effective, real-time geographic information system-based surveillance to expose or identify these new persons who had either had the antibodies or PCR positive. These must go in parallel with the effective reporting system and promptly making this information available truthfully without hiding to the public at large on a daily or at least 2 or 3 times a week basis. So the real-time community-based surveillance data are essential to not only for testing new patients but also for understanding the pattern of the spread of the disease and for future prediction, resource allocation, and taking database or based proactive actions. So next point I like to re-emphasize is the boosting the immunity using the broader strategies are essential. Again, no country is doing this at all or doing efficiently. This includes a safe sun exposure guideline and encouraging the public to do so. Mass-scale vitamin D supplementation in communities is the easiest and the most effective way to boost the immunity so that people will not get complication from the disease, or if you get the disease, it actually had a very, very mild manifestation. Simply because vitamin D strengthens the immune system and it's the number one way to do it and most economically. The provision of supportive environment and the use of effective empirical therapies such as hydroxyquinone and zinc, etc., together with the micronutrient or diet rich in the nutrients and having adequate rest, sleep, and a reasonable amount of physical activity on a daily basis. All this help to boost the immune system and reduce the complication from COVID-19 if one gets it. And then is the informing the public the real situation and proactively explaining the reason for adding or relieving restriction and how they do it in a systematic fashion, taking and other action openly to the public. This including the transparency, and this will improve the trust of people and consequently communities and the population will comply with the instruction rather than disobeying the governmental instruction. Because you cannot force people's behavior in contrast to military or administrative misguidance. Dynamic effective disease prevention guidance also important to prevent the public, including from restricting gathering anything more than two or three people at a time, and most certainly to avoid creating panic situation as again done by many governments mistakenly. Encouraging people to engage in a good personal hygiene is equally important, should go in parallel hand, but that's a small part of the entire story. This including hand washing and the use of face masks every time when people getting out of home, avoiding meeting people in masses and crowded places, and indeed proactively reducing the exposure to virus. Finally, once available, the use of effective vaccine and antiviral agent is a given. However, no administration or any country should rely upon these either the vaccines or antiviral agents, as neither of these had ever been materialized as effective or safe agents against the coronavirus. This is a pharmaceutical and administrative driven myth spreading so that they can actually generate trillions of dollars out of nothing from the community by providing, unfortunately, somewhat worthless vaccine and a very expensive antiviral agent, when the disease can be prevented exceptionally effectively at a cost of less than $5 or £3 or 300-400 rupees per person by safe exposure, sunshine, and mass scale supplementation with vitamin D. Thank you. Next video, we are going to discuss about the boosting the immunity with the micronutrient. Since then, have a good day.